Hi there. One of the most common medical malpractice cases that we get here at Funk Law Group is a misdiagnosis of cancer. A lot of folks call it a misdiagnosis of it, but in fact, I always like to call it a missed diagnosis of cancer, meaning the patient came with all the symptoms that were telltale for cancer, but the primary care physician didn't do enough to send the patient somewhere to get diagnosed with proper cancer diagnosis. Typically, what happens is a patient comes in and is suffering from various ailments, and the primary care physician looks at it as though we need to solve the ailment and not necessarily think about the big picture. So, for example, somebody comes in with massive weight loss, not due to exercise or diet, just losing a lot of weight, or constant fatigue, or, for example, trips and falls due to loss of coordination. These are all telltale signs that something is happening inside the body. When a primary care physician or a hospitalist gets that information, if they cannot actually treat the patient themselves, they must refer to a specialist. That's the number one standard of care. Send the patient on to a cancer specialist who can run the proper tests to know exactly what is going on in the body. That is typically where primary care physicians make a mistake. They believe that they are just treating the ailments and they will be able to fix that patient, but not necessarily fix the root of the problem. When that occurs, of course, cancer diagnoses come very late. And with a late diagnosis, treatment options become an issue. When a stage of a cancer progresses due to a missed diagnosis, then certain treatments are no longer available, and now the patient must undergo even further treatments that weren't necessary had the cancer been caught much earlier. If you or a loved one suffered from cancer and you believe that it should have been caught much earlier, then you need to speak to a medical malpractice lawyer to know your rights. My name is Adam Funk. I have handled hundreds of misdiagnosis cancer cases, and I'd be happy to handle yours and talk to you about it.